Question 1. A client with increased intracranial pressure ICP is being monitored. Which finding requires immediate nursing intervention? A. Pupils equal and reactive to light. B. Decrease in Glasgow Coma Scale from 13 to 10. C. Blood pressure 138/82 mmHg. D. Heart rate 78 BPM. Answer. B. Decrease in Glasgow Coma Scale from 13 to 10. Question 2. Which patient should the nurse assess first? A. A client with Bell's palsy reporting dry eyes. B. A client with Guillain-Barré Syndrome experiencing difficulty breathing. C. A client post-stroke with slurred speech. D. A client with migraine requesting pain medication. Answer. B. A client with Guillain-Barré Syndrome experiencing difficulty breathing. Question 3. Which task can the nurse delegate to an experienced UAP caring for a client with a seizure disorder? A. Administer phenytoin. B. Teach seizure precautions. C. Document seizure activity. D. Place padded side rails on the bed. Answer. D. Place padded side rails on the bed. Question 4. The nurse finds a post-op craniotomy patient with clear drainage from the nose. What is the priority action? A. Continue monitoring the drainage. B. Test the drainage for glucose. C. Suction the nasal passage. D. Apply a nasal drip pad. Answer. B. Test the drainage for glucose. Question 5. Which client is at highest risk for developing aspiration pneumonia? A. A client with multiple sclerosis reporting fatigue. B. A client with Parkinson's disease and dysphagia. C. A client with myasthenia gravis reporting diplopia. D. A client with ALS using a walker. Answer. B. A client with Parkinson's disease and dysphagia. Question 6. A nurse is assigning patients. Which client should be assigned to the LPN/LVN? A. A client admitted with acute stroke showing signs of increased ICP. B. A client with multiple sclerosis needing discharge teaching. C. A client with myasthenia gravis requiring hourly respiratory assessment. D. A client with Parkinson's disease needing scheduled levodopa administration. Answer. D. A client with Parkinson's disease needing scheduled levodopa administration. Question 7. During a tonic-clonic seizure, what is the nurse's priority action? A. Restrain the patient to prevent injury. B. Place a tongue blade in the mouth. C. Turn the patient to the side and protect the head. D. Start oxygen therapy via mask. Answer. C. Turn the patient to the side and protect the head. Question 8. Which symptom indicates a complication of increased ICP in a head injury client? A. Frequent yawning. B. Projectile vomiting. C. Mild headache. D. Photophobia. Answer. B. Projectile vomiting. Question 9. Which task should be prioritized by the nurse when caring for a client with meningococcal meningitis? A. Encourage oral fluid intake. B. Monitor temperature every 4 hours. C. Institute droplet precautions. D. Assist with ambulation. Answer. C. Institute droplet precautions. Question 10. A client is admitted with suspected bacterial meningitis. What is the priority nursing intervention? A. Monitor input and output. B. Elevate the head of the bed. C. Administer prescribed antibiotics. D. Perform passive RUM exercises. Answer. C. Administer prescribed antibiotics. Question 11. Which patient requires immediate intervention by the nurse? A. A client with a concussion sleeping intermittently. B. A client with a brain tumor experiencing projectile vomiting. C. A client post-lumbar puncture reporting mild headache. D. A client with migraine lying in a dark room. Answer. B. A client with a brain tumor experiencing projectile vomiting. Question 12. UAP reports that a patient with myasthenia gravis is too weak to eat breakfast. What is the nurse's best initial action? A. Notify the provider immediately. B. Feed the patient. C. Administer 4 fluids. D. Assess the patient's ability to swallow. Answer: D. Assess the patient's ability to swallow. Question 13. The nurse is caring for a client with a spinal cord injury at T4. Which assessment finding is most concerning? A. Bradycardia and hypertension. B. Muscle spasms in the legs. C. Warm, flush skin. D. Constipation. Answer: A. Bradycardia and hypertension. Question 14. Which action should be delegated to a UAP caring for a client with multiple sclerosis? A. Instruct on bowel training techniques. B. Assist with ambulating using a gait belt. C. Evaluate need for assistive devices. D. Teach energy conservation techniques. Answer: B. Assist with ambulating using a gait belt. Question 15. A client with a cervical spinal cord injury complains of a pounding headache. What should the nurse do first? A. Administer analgesic. B. Check for bladder distension. C. Notify the provider. D. Elevate the foot of the bed. Answer: B. Check for bladder distension. Question 16. Which symptom in a client with ALS requires priority nursing intervention? A. Muscle twitching. B. Difficulty sleeping. C. Shortness of breath. D. Slurred speech. Answer: C. Shortness of breath. Question 17. The nurse is planning care for a client with right-sided stroke. Which is the priority goal? A. Client will verbalize understanding of expressive aphasia. B. Client will perform active RUM on the right side. C. Client will demonstrate safe transfers with minimal assistance. D. Client will feed self independently. Answer: C. Client will demonstrate safe transfers with minimal assistance. Question 18. What assessment finding in a client with meningitis indicates possible brainstem herniation? A. Positive Koenig sign. B. Fixed and dilated pupils. C. Nuchal rigidity. D. Photophobia. Answer: B. Fixed and dilated pupils. Question 19. Which task should the nurse assign to an experienced LPN/LVN? A. Titrating for dopamine in a head trauma client. B. Teaching family about seizure precautions. C. Monitoring vital signs in a stable stroke client. D. Performing a neurological reassessment post-seizure. Answer: C. Monitoring vital signs in a stable stroke client. Question 20. A client recovering from a stroke suddenly becomes confused. What should the nurse do first? A. Perform a glucose check. B. Call the rapid response team. C. Reorient the client. D. Check the medication list. Answer: A. Perform a glucose check. Question 21. Which intervention is most appropriate for a client experiencing expressive aphasia after a stroke? A. Encourage client to speak louder. B. Provide a picture board for communication. C. Speak rapidly to stimulate memory. D. Offer complex written instructions. Answer: B. Provide a picture board for communication. Question 22. A nurse is assessing a client with multiple sclerosis. Which finding is most concerning? A. Urinary frequency. B. Fatigue after activity. C. New onset of vision loss. D. Muscle spasms. Answer: C. New onset of vision loss. Question 23. Which task is appropriate for a UAP caring for a client post-seizure? A. Assess for postictal confusion. B. Document seizure activity. C. Take vital signs. D. Educate the client on triggers. Answer: C. Take vital signs. Question 24. A client is being treated for myasthenia gravis. Which finding should be reported immediately? A. Ptosis. B. Muscle weakness at the end of the day. C. Difficulty swallowing. D. Diplopia. Answer: C. Difficulty swallowing. Question 25. A nurse is educating a client with Parkinson's disease about fall prevention. Which statement indicates effective teaching? A. I will walk quickly to maintain balance. B. I will avoid using assistive devices. C. I will take small, deliberate steps. D. I will keep my feet together when walking. Answer: C. I will take small, deliberate steps. Question 26. Which finding in a client with a recent head injury requires immediate action? A. Sleepiness after pain medication. B. A mild headache. C. Difficulty arousing the client. D. Bruising at the injury site. Answer: C. Difficulty arousing the client. Question 27. Which client can be safely assigned to the LPN/LVN? A. A client with new onset of stroke symptoms. B. A client with a spinal cord injury in respiratory distress. C. A client with a seizure disorder needing discharge teaching. D. A client with stable multiple sclerosis needing bladder training. Answer: D. A client with stable multiple sclerosis needing bladder training. Question 28. What is the nurse's priority action for a client with a suspected stroke who arrived 30 minutes ago? A. Insert a Foley catheter. B. Prepare for immediate CT scan. C. Start for fluids. D. Elevate the head of the bed. Answer: B. Prepare for immediate CT scan. Question 29. The nurse is reviewing orders for a client with increased ICP. Which order should the nurse question? A. Administer stool softeners. B. Keep head of bed at 30 degrees. C. Perform frequent suctioning. D. Monitor neurologic status every hour. Answer: C. Perform frequent suctioning. Question 30. A client with ALS is being discharged home. Which referral is most appropriate to support client safety? A. Speech therapist. B. Occupational therapist. C. Dietitian. D. Psychiatrist. Answer: B. Occupational therapist. Question 31. Which symptom in a client with bacterial meningitis requires urgent intervention? A. Fever of 101 degrees Fahrenheit. B. Sensitivity to light. C. Seizure activity. D. Stiff neck. Answer: C. Seizure activity. Question 32. A nurse is preparing to assess cranial nerve function in a client with suspected neurologic damage. Which test evaluates cranial nerve 3? A. Facial symmetry. B. Pupil reaction to light. C. Hearing acuity. D. Tongue movement. Answer: B. Pupil reaction to light. Question 33. The nurse is planning care for a client with right-sided paralysis after a stroke. What is the priority intervention? A. Teach the client to use the left hand. B. Encourage independence in self-care. C. Apply splints to both arms. D. Place the call light on the left side. Answer: D. Place the call light on the left side. Question 34. A client with increased ICP is receiving mannitol. Which assessment finding requires immediate action? A. Urine output of 100 milliliters per hour. B. Crackles heard in bilateral lungs. C. Serum osmolality of 300 milliosmoles per kilogram. D. Blood pressure 120/70. Answer: B. Crackles heard in bilateral lungs. Question 35. The nurse is caring for a client with meningitis on droplet precautions. Which action by the UAP requires intervention? A. Wearing a surgical mask when entering the room. B. Delivering a meal tray without gloves. C. Leaving the client's door open. D. Assisting with oral hygiene. Answer: C. Leaving the client's door open. Question 36. Which intervention can help reduce ICP in a client with a closed head injury? A. Positioning the client flat in bed. B. Providing frequent suctioning. C. Avoiding coughing and straining. D. Administering hypotonic fluids. Answer: C. Avoiding coughing and straining. Question 37. A client post-lumbar puncture reports a headache. What is the nurse's best response? A. Encourage fluids and keep the client flat. B. Administer anticoagulants. C. Notify the neurosurgeon immediately. D. Perform a neurologic recheck. Answer: A. Encourage fluids and keep the client flat. Question 38. Which neurologic finding requires immediate action in a client who had a stroke yesterday? A. Hemiparesis. B. Expressive aphasia. C. Sudden confusion. D. Facial droop. Answer: C. Sudden confusion. Question 39. The nurse is performing discharge teaching to a client with a seizure disorder. Which instruction is most important? A. Keep a seizure diary. B. Avoid driving until cleared. C. Increase fluid intake. D. Maintain a low-sodium diet. Answer: B. Avoid driving until cleared. Question 40. A nurse is assessing a client for autonomic dysreflexia. Which symptom is most indicative? A. Hypotension. B. Bradycardia with facial flushing. C. Blurred vision with cold extremities. D. Hypertension with headache. Answer: D. Hypertension with headache. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.